Well, my work with the street homeless of Pittsburgh began in 1992. As a medical educator, I was concerned about my students and my peers because we have two different worlds. There's the world of medicine and the world of people, particularly poor people. And the ability to see through the eyes of the poor was something I thought should be taught and experienced. But I realized I needed a radical environment to really get to where I wanted to be. And so I found a man who was formerly homeless, who was willing to take me under the bridges of Pittsburgh and into the homeless camps. But he told me I couldn't dress like a doctor. And so I actually put on the clothing of a homeless person as I understood it. And I joined him, to begin making visits to the people on the street and to gain their trust. Well, in my case, I was able to combine my teaching career with this kind of work. It's difficult for any doctor or nurse or other person who wants to work with the people on the street to balance their career. And so I actually spend time helping people in other communities, cities throughout the world to start street medicine programs. And that is always an interesting puzzle, is how do you support yourself? There are various strategies, but in my case, education helps because you have a salary and you're able to, if you can do it in a proper way, you can include it within the teaching of your career. Well, the street medicine movement, and street medicine is just a term I coined maybe about 12 years ago or so. But it's a grassroots movement, and it is still difficult to do the same kind of measurements within our community that you could do in a hospital system on outcomes. But we've been able to get people into primary care from the streets. We've been able to get people into housing. In Pittsburgh, we've housed approximately 1,400 people in their own apartments. And I'm convinced through my own experience that we've saved many, many lives directly and indirectly through our network. As far as spreading this as a movement, we are now having our 12th International Street Medicine Symposium in Geneva this October 20th and 22nd. We have representation from all 6 continents. There are approximately 50 to 60 programs in the United States and about an equal number in the rest of the world that are part of our network. All of us as physicians, we see illness and suffering, and we begin to understand the factors in society that prevent people from being able to get well. I think we get discouraged and want to just stay in our box. But my first advice is don't ignore reality. We have to try to see things through the eyes of those who are excluded and then join with them. They become our teachers, and you, in whatever setting you go, listen to your patients and connect with them. My work before this was with domestic violence, and the victims of violence taught me a great deal about how healthcare looks from their point of view. I find that if we partner with the community and with people who are suffering, together we can create solutions. This is why our tagline for the Street Medicine Institute is "Go to the People." When you start, it seems overwhelming, but it's also the beginning of a great adventure to get out of the hospital, to connect with people. Um, I think this is the way healthcare is going to be in the future. It has to be this way because we have to ground our work in the trust and solidarity that we have with the people who are suffering, and then with them create solutions. Well, I think the street medicine movement itself has great value, and I would love to see every community in the world that has people on the streets have a street medicine program. People who go out to them and and engage them and see them as brothers and sisters and work with them in their own setting to help them get off the streets and help them get healthy. So that's the vision. Um, this is happening, and I wouldn't have guessed back in the 90s that it would have gotten this far. The Street Medicine Institute is still a nonprofit organization that is also grassroots, but I foresee that it will gain financial and other types of support to be able to continue this and make this a field of medicine to bring care to people who currently are hopeless. I see medical schools embracing street medicine as they're beginning to do as part of the teaching curriculum of every health science school. And I think this will transform the types of students and future physicians and nurses that we create who understand and are empowered to meet people where they are. I'd say in 10 years, hopefully, street medicine will have made these strides, but also that we will have been able to influence the thinking of healthcare in general. And I see these discussions happening in other movements and other colleagues and thought leaders around the world. So I'd love to join with them and bring care that is relevant to people and not just rely on the business model and fear-based methodologies that we've had in the past.